And we're go. Okay.
Hello, my name is Jonah Funkel. I am a student physical therapist, and I will be working with you this morning.
This is scenario F.
You want to read the scenario too?
The scenario, okay. Here's the chart. The patient is a 30-year-old with a severe concussion status post-fall. She fell as we're trying to climb over seats in Minute Maid Park, chasing after an Astros fly ball. Due to infection and poor hygiene, she has had a left transtibial amputation 2 days ago. She has a caretaker since she does not seem to follow verbal commands consistently. Alright, so 2 appropriate vital signs: blood pressure, important, after concussion, and also with infection, and pain due to a recent surgery. You know how those questions go, and how the actions are. Alright, first exercise, perform stretching of her left hip flexors.
You forgot PPE again.
It's okay. It's okay. What you gonna do for PPE?
In this case, because the patient has an infection and has had a recent surgery, and especially because of the bad hygiene, I am leaning towards putting on full PPE, gown, mask, and gloves. I would put on my mask first, then my gown, and then my gloves, before I enter the room.
After you.
And after I wash my hands. Okay. All right, now beginning the exercises. First thing I have to do is scoot towards me. Good. I want you to roll over onto your right side. And for this first one, does not specify, but left hip flexor stretching. Just gonna go ahead and
You need to put this hand here.
this is gonna be weird because you have to imagine there's nothing there. All right, so
What? Huh?
all right, just gonna go ahead and bring the leg straight out across. Hold the stretch. Return to neutral. And again.
Silly question. Should you be using your torso to block her back behind her trunk and be using both hands to support even like the distal portion of her leg?
No.
Doesn't matter?
You can use your torso to reinforce your hand, but most people's hip flexors are so tight that the torso wouldn't be
I just
enough.
wanted to make sure that this distal portion of her leg isn't like flopping. I
But
don't
in
know.
this case,
I don't
it's an
know.
amputation.
yeah.
So, and you can't
Okay.
really grab what's left because then you're supporting on the knee.
But
and that's-
we asked about that, and Andy did say that the transtibial amputation happens low enough that you can grab the lower leg. Just FYI, so you may not have heard that.
Yeah, if it's below the knee.
The amputation site and the knee.
Okay.
Just a thought.
So it'd be more here?
That's where the amputation is, and he can grab underneath your knee in between the amputation.
Okay.
So does that change my hand placement for up here? Yes or no? No?
I don't think so necessarily.
All right. Just gonna come to the motion. Of course, that would be one leg behind the other.
30 seconds.
30 to
Hold it.
60 seconds. Mhm.
Hold this for 30 to 60 seconds. Turn to neutral. And now we're going to do that one time or a second time.
3, like 3 times, whatever.
Okay, you can do this about 3 times. 30 to 60 seconds. All right, 3 times. Go ahead and. Okay, next. Active assisted range of motion, left hip abduction. Okay, I want you to roll back onto your back. Yeah. All right. What we're gonna do is, I'll just go ahead and show you the motion first. We're gonna move your hip and your leg straight out in this direction as far as you can, and hold, and return to neutral. I want you to give me as much motion as you can. I'm going to.
What's neutral?
I shouldn't have said that. All right, just back onto the mat. And I want you to give me as much motion as you can. I'm going to help you through the motion. Okay. All right, so whenever you're ready, just bring your leg towards me. Keep going, keep going. Good. Pause.
Slow. More slow.
Back onto the mat. Okay, again. One leg is positioned behind the other.
Tight hip
It
abductors.
should be like you're sitting in a chair whenever you're moving through the motion. Pause and back into the mat. We'll do this 10 times. And then,
One more thing, when you were doing the extension, the hip extension, you can remind the patient she's turned onto her side. She can hold onto her bed rail to help stabilize her.
And you can move the knee, if she's unstable, you can move the knee up higher, the bottom.
Just
up
options,
higher.
they're here for you.
cool. I didn't cover that before. All right. And then teach your caretaker how to do long-term positioning and sitting in a wheelchair. Okay. That is so basically what you would do,
Pretend I'm a family member.
alright, so anytime your family member here is sitting in a wheelchair or just sitting up in general, you don't want to keep that leg supported and straight. You do not want to let it stay bent over a long period of time, so you would not put a pillow underneath the knee, because then that could lead, it can lead to tightness and would make it difficult for use of a prosthetic, things like that. So it might be a little uncomfortable, so you want to keep that leg nice and straight. And also,
Can you just show me how to put, because this looks complicated. I don't know how I'm gonna even get her to the wheelchair. I've never done that before.
wait,
I'm a family member.
we never did transfer.
No,
Oh,
just
yeah.
say like,
Yeah, like I'm gonna help her into it.
Okay,
right? So-
magic transfer over.
say, all right, put her shoes on, get her over
Well,
here.
one shoe.
Two, well, one, yeah, one. Okay. Let them do it before I sit down.
Okay,
So you're like.
now you use our high-tech board.
Show the setup.
First thing you're always going to do.
Note of the video that this is a bunk wheelchair and that's a bunk board, so this is not what we will be using.
Alright, so you always want to make sure that the wheelchair is locked, so
Okay.
it doesn't slide out from underneath your family member. And then, whenever, before you place her on the wheelchair, we're gonna make sure that this is there, so she has something to put her leg on, to keep her leg from bending. And then, you also want to balance that out with the pillows. You don't want her to be hunched over to one side, so you're gonna pillow. Sit on. And then, you're gonna put one,
Annabelle had us doing 90 degrees. If this were actually a true board,
Yeah,
you do 90 degrees to that board for stability purposes.
and also, are you using that pillow right there because we have some like messed up board,
Yeah,
or?
pretty much.
Okay, so in a normal situation, you wouldn't even, that
Need
pillow is completely irrelevant.
You only need the one that's 90 degrees normally.
so for practical, I'm just gonna put this one.
Yeah.
Alright, so you're gonna put this pillow to kind of help counteract the position from one leg being.
She's gonna be so high up.
Alright, so make sure it's nice and flat. And then, she would sit in the wheelchair.
Now, here you can tell the family member to instruct the patient. Reach back with your left hand back here to hold on to the wheelchair to stabilize yourself to get into it.
But since
And go
there's
ahead and
no,
pull it back.
there's no armrest for the chair.
Right.
Oh my
And now
god.
you can use your arms to reposition yourself. Okay.
This is like the word.
It's a contraction.
Alright, and then from here, last thing we want to make sure is that the back isn't bent in the wrong position. So just for a bird's eye view, you should be able to tell if the hip is bent too far forward or backwards. You want to avoid that. So in this case, we'd probably just put a pillow behind her back. Make sure it's nice and flat. Okay. And that allows the hip to.
Last thing you already said, I don't want you to let that knee flex. So
Okay, so I'll put this.
in between the amputation site and the knee, right under here.
Okay, so whenever you place this under the leg, you want to make sure it's not underneath the knee, but underneath the calf.
Yep.
This will allow the leg to stay straight, keep it from getting tight. And
If I had armrests, arms
Arm-
would be here, or you could put a pillow here.
with the wheelchair, you want to adjust the armrest to where the arms can naturally just stay at her side, adjust for height, and that's it.
All